On va clore ce cycle de masterclass en recevant deux invités exceptionnels qui, au sein de leur DG, armaturent la stratégie européenne de lutte contre le cancer. Une stratégie qui s'appuie sur deux axes forts. On le dit, on le répète, ce plan européen annoncé l'an passé, dont la mise en œuvre démarre. Aussi cette mission cancer qui va renforcer l'effort de recherche sur ces sujets. Pour mieux comprendre ces dispositifs, mieux comprendre leurs impacts, je vous prie d'accueillir très chaleureusement Joanna DRAKE et John Ryan qui sont avec nous. Joanna DRAKE, directrice générale adjointe à la direction générale de la recherche et de l'innovation de la Commission européenne. John Ryan, directeur général adjoint à la DG Santé Sécurité Alimentaire de la Commission européenne. Vous êtes là tous les deux ensemble et c'est beau aussi de le voir pour nous parler de ces deux éléments forts que vont être la mission et l'implémentation du plan. Joanna, je vous laisse peut-être la parole au début pour en quelques instants nous présenter justement ce que sera cette mission. Après, John nous parlera du plan et on prendra quelques questions. Oui.
Okay. Thank you very much.
It shall work. It does.
Okay. Hello, everyone. Good afternoon. My name is Joanna DRAKE. I'm very pleased to be here to say a few words on the cancer mission. In my dual capacity, if you like, as Deputy Director General of the Direction Générale of Research and Innovation, European Commission, but also as Mission Manager for Cancer. John is obviously my pillar from the health side of the Commission, so we work very well together. I would like to thank, first of all, the French Presidency for this event. And also for the organizing this event, the National Cancer Institute for Cancer. It's an important date today for three reasons. One, 22 years ago, the World Cancer Day was born at the World Summit Against Cancer for the new millennium, and it was here in Paris. Today also marks the first anniversary of Europe's Beating Cancer Plan, which is a political commitment to turn the tide against cancer and the stepping stone towards a strong European health union. Definitely last but not least, French President Emmanuel Macron unveiled an ambitious 10-year cancer control strategy built together by the French National Cancer Institute, the French cancer community, and the French citizens. The European Commission has tried to match these efforts by making cancer one of its main priorities by presenting two major initiatives. First, the Europe Beating Cancer Plan in February of last year, and this is what John will be talking about. And secondly, by reinforcing that with a mission on cancer in September of last year. I would say that the concept of mission is quite a novelty in the European Commission. It's a novelty within the house where I come from, which is DG Research, because within the Horizon Europe Research and Innovation Programme, it is the first time that we have thought about global strategic challenges and actually try to organize and cluster the funding mechanisms, the objectives to be reached, and the blending of priorities, strategic objectives, and funding under global labels, if you like, and one of them is cancer. So cancer, climate change, restoring our oceans and waters, climate neutrality and smart cities, and healthy soils. These are the 5 labels I've just talked about. The missions aim at achieving a goal that is measurable for citizens, and I think this is the accent. It could not have been achieved through individual actions. Of course, all member states individually, and I would say maybe even in certain clusters, doing a lot on all 5 of them, but we are saying we need to achieve more as a European entity. So what does the Mission on Cancer try to achieve? We have a very definite objective, and that is making the lives, improving the lives of 3 million people by 2030 through prevention, through care, through cure, and for those affected already by cancer, including the families, to live longer and better. But how can we achieve this ambitious goal? Well, we have to be hands-on, and this is why John Ryan is here to present the plan, the Europe Beating Cancer Plan. What will the Mission on Cancer strive to achieve? It will deliver on innovative concepts and solutions for implementing specific parts of the Europe Beating Cancer Plan. And this is why we are complementing each other's actions and objectives, and therefore we are going beyond research and innovation. The mission will generate knowledge and evidence for the implementation of new policy actions in the areas of cancer, understanding prevention, diagnosis, treatment, and quality of life. Equally, the Europe Beating Cancer Plan will inform the mission's research agenda towards more efficient policymaking. What are the specific objectives of the Mission on Cancer? First of all, understanding cancer better. And this, we believe, will enable the effective cancer prevention and screening programs, devices, diagnostic tests, as well as treatment and care solutions adapted to each patient. And this, for instance, would include the establishment by 2023 of the so-called uncan.eu platform, which will be a unique digital platform where researchers from Europe and beyond will share and have access to high-quality research data. Secondly, prevention. How? Through screening and early detection. We are saying that there should be enhanced and more effective prevention measures and programs in order to help exploit the potential of preventing 40% of cancers. This will allow starting adequate and more, in cases, less invasive treatments, increasing the chances of survival and improving the quality of life of people living with and after cancer. And a concrete example of this is the development by 2025 of a one-stop cancer information center on prevention. Thirdly, diagnostics and treatments of cancer, the development of optimized diagnostics and treatments of cancer coupled with the principle of equitable access, which will ensure that more patients have access to the latest, minimally invasive treatments adapted to their conditions and with minimal secondary effects. Finally, better quality of life for cancer patients, survivors, and their families. For instance, through the creation by 2023 of a European Cancer Patient Digital Center, which helps provide personalized care for patients and survivors. A few words on how to implement all this. We have the first Horizon Europe Work Programme 21-22, already published last year. It included already a set of actions that laid the ground for the implementation of the EU Mission on Cancer, in particular kicked off the preparation of the uncan.eu platform. We published the first amendment of this program in December, last December, and there we had 3 research actions to support the Mission on Cancer with a budget of 125 million euros. The first action should allow a better understanding of the impact of risk factors and health determinants on the development and research and development and progression of cancer. Second one should help the development of new methods and technologies for cancer screening and early detection. And the third action concerns the development and validation of a set of quality of life and patient preference measures for cancer patients and survivors. The second amendment to the program, to the work program with additional topics, will follow very soon in spring of this year, a couple of months' time. Last point that I would like to emphasize, and that is the key role of member states in all this and the stakeholders. Of course, the goal is ambitious. We're saying 3 million people's lives by 2030 needs to be improved. But can we do it alone? Can we do it in isolation? I won't answer that, but I think we all know that doing it together will yield better results if we were well organized, well coordinated, and everybody is giving his share. So if we're all engaged, and by the we, I mean EU institutions, the member states, the regions, academia, citizens, patients, NGOs, industry, and charities, this goal is achievable. Many of the actions foreseen under the mission fall under the responsibility of member states, under the responsibility of regions or even local actors. And therefore, achieving this goal will require their commitment and support in implementing actions on the ground. And this is what is key, I think. To ensure a continuous dialogue with and between member states, DG Santé, here represented by John, and DG RTD, represented by myself, have created a joint subgroup on cancer under what is called the Steering Group for Health Promotion and Disease Prevention. And what does this group consist of? It is made up of experts from research and also the health ministry. So the coordination, the nucleus of the coordination is already there. And under this group, there have already been developed 6 thematic groups, subgroups, to focus on the implementation of all the aspects that I have been mentioning under the mission and also under the Europe Beating Cancer Plan. And therefore, the engagement of all stakeholders is extremely important for the success of the mission. In fact, as part of the joint governance structure of the mission on cancer, our both Directorate General have established a dedicated stakeholder contact group under the EU Health Policy Platform, and this will be consulted and is being consulted in its entirety on a regular basis, but also on an ad hoc basis via its thematic subgroups to discuss specific aspects of Europe Beating Cancer and Mission on Cancer. In fact, the stakeholder event already took place in November last year, which gathered already more than 600 participants. And in fact, the broad diversity of participants and a high degree of interaction demonstrated not only the will from stakeholders to make the fight against cancer a common priority, but also the importance for all of us to engage in dialogue. And I see this masterclass, in fact, as an integral part of this dialogue and actually driving the message home that this needs to be more regular and more continuous. Okay, I think I'll conclude with a few words from the Paris Charter Against Cancer of the 4th of February, the year 2000, the millennium year, and I quote, "Let's aspire to nothing less than an invincible alliance between researchers, healthcare, professionals, patients, government, industry, and media to fight cancer and its greatest allies, which are fear, ignorance, and complacency." Thank you.
It's your turn, John.
So thank you very much, and thank you for the invitation to speak to you today. I wanted to explain in a few words about the Europe Beating Cancer Plan. The Europe Beating Cancer Plan is an unusual animal because it's not something which was written only from a health perspective, but we really reached out to all of the policy departments within the European Union to try and find out what would be the levers that we could pull that would help in the fight against cancer, particularly in the prevention side, but also in some other areas. And therefore, this cancer plan is unusual because when we have adopted other public health plans, they're very often restricted within the public health sphere, and then we wonder afterwards why they didn't have the effect we were hoping for. So I think this health in all policies approach is really one which I would emphasize for the cancer plan. It includes research, but it also includes things you might not suspect. For example, the reform of the Common Agricultural Policy. My colleagues at the moment are examining à la loupe all of the national reform plans for the Common Agricultural Policy. And you might say, well, what has that got to do with me? Well, it has a lot to do with you, in fact, from the prevention point of view, because, of course, better nutrition, producing better food, encouraging people to have more healthy diets. I mean, what is more central to cancer prevention than that topic? Luckily, when I was here the last time in Paris with Maurice Tubiana and with Albert Hirsch and other colleagues of that generation, we were still financing tobacco growing from the EU budget. We're not there anymore. We've managed to take out tobacco production from the EU budget, which was already a fight at that time, I can tell you. Now we have a different set of fights to carry out, I would say. So this is the first point I wanted to make. The cancer plan is really trying to look as wide as possible over the different factors which could influence cancer and which can help us over a number of years to change the situation. Second point I'd like to make is that there's a focus on prevention, bringing together the different angles which in EU policy could change prevention. We just heard about tobacco. There will be a revision of the legislation on tobacco at EU level. We're also discussing how to stop people crossing borders and importing large quantities of tobacco, which is not really for their own use, but maybe for resale, for example. So there are lots of things in the area of taxation where I think you can have an influence. Common agricultural policy I referred to, but also things like sunbeds. Sunbeds are a major risk. We know how dangerous they are, but yet we can't get our act together to actually do something. So this is one of the ambitions in the cancer plan, is also to reduce the risk factors caused by sunbeds. And maybe a fourth example I would give in a more positive mode is the importance of physical activity. Well, you've all been sitting here since 9 o'clock this morning, so I guess you're all looking forward to moving. But physical activity is also very important, of course, as a prevention factor. Bringing all of these things together, these prevention messages in the European Code Against Cancer, which EARC was central in developing and keeping up to date and making scientifically valid. I'm a vegetarian myself, but one of the messages in the cancer plan refers to the consumption of red meat. Very controversial, but science-based. So there are a number of issues there which are new and some which are old. The smoking message, for example, is old. We have to find new ways of combating tobacco for a new generation. Then the second focus area of the plan is in relation to screening. And there we have cancer screening recommendations which cover breast, cervical and colorectal cancer at the European Union level, and a whole series of activities for quality control, for assessment of cancer screening centres, and regular reporting and transparency, training courses, that sort of thing. We're now in the process with our colleagues in the research side of reviewing the evidence on cancer screening. Do we have a consensus for extending screening beyond those 3 cancer sites? Are there new techniques or technologies that we could use? Medical imaging, for example, how have we integrated that in our cancer screening recommendations? So all of these are being looked at. And at the end of this year, the beginning of next year, we'll be publishing a new legal act to bring the member states together in a council recommendation on cancer screening. Let me say that when we negotiated the last council recommendations, the problem was not the scientific consensus. The problem was the cost. And I remember there were several member states who were actually quite scared about how much it was going to cost. So this shouldn't be completely forgotten. You might think that cancer screening is an entirely scientific discussion. In fact, there's a lot more to it than just science. Then we have the whole area of treatment and better treatment. Now, we know innovative medicines have a big role to play. We know the impact of European systems like health technology assessment, the reform of the pharmaceutical legislation, the clinical trials directive we've heard about earlier on. There are many European levers which we can try and move to encourage the development of new pharmaceuticals. We have the problem, though, of inequality of access. So it's not satisfactory that we're just producing new medicines, but we're not looking at how these medicines actually are delivered to people. Because even in something as basic as cancer screening, there are huge differences between the member states in the take-up of cancer screening. And it's exactly the same with innovative medicines. The access to medicines is really a problem across the EU. So how can we use the cancer plan to encourage the development of innovative medicines, but also the access to medicines, I would say? And the last part of the plan, which is, I think, interesting and innovative, refers to quality of life. And I was looking at some of the paragraphs in your statement, which has been built up in parallel in the working groups. And one thing that really struck me was the issue of return to work, because, you know, this is a medical sort of meeting, I guess. But the issue of return to work and the right to work is really important, I think, for somebody's health. You know, if they have cancer, they're successfully cured, but they don't have a job to go to, well, then they still have a problem. So I think it's part of the plan, and this was the idea we had in the European Commission, to see what levers we could pull within our legislation and our employment policy in order to make sure that cancer patients and their families and their carers would have their employment rights protected. And this is something we're trying to do. Second example, also mentioned in your statement, is the issue of the right to be forgotten. Very important for things like access to finance. If you have a cancer, you go to your doctor, you're cured, but you don't have a job and you don't have the possibility to get a bank loan. You can't buy a house, you can't buy a car. Well, you're not in a very good situation. So is there something we can do at the European Union level on this right to be forgotten, on financial rights? So we've tried really to cast the net very far with the cancer plan and try and pick up these topics which refer not only to the medical aspects of cancer, but also the quality of life of cancer patients. And I'm sure I could talk a lot more about it because there's a lot of detail, but maybe I just mention a point which Joanna mentioned, which is the governance. Now you might say, well, we don't care about the governance, but in fact you should, because the governance is it's not the Commission is managing this, it's you in the Member States are managing it in a group of your ministries, not only the health ministries, but the research ministries sitting together. And let me tell you that when we started this a few years ago, 2 years ago, the people didn't know each other. People from the research ministries and the health ministries were introducing themselves. Maybe not in France, because you have a fairly sophisticated system in France, but I can tell you it was the case for a number of member states. And that was really a surprise. We thought that everybody knew everybody, but in fact it wasn't the case. So I think having different ministries and different departments working on the cancer plan is one aspect. Internally in the Commission, we have our own group where all the policy departments, taxation, agriculture, health and safety at work, carcinogenic substances in the workplace, radionuclear medicine, all of these people are sitting together to discuss the cancer plan. So it's not something in the past, it's something in the future. We're working together to try and make sure that everything happens on time. And lastly, Joanna mentioned as well the stakeholder groups. So we've really thrown the door open to the involvement of stakeholder groups. So patients, health professionals, oncologists, researchers can sit down together across Europe and discuss what they would like to see implementing the cancer plan. So those were the points I wanted to make now. I don't want to go into too much detail, but to give some time for discussion maybe. But really I think it is a major initiative. It's the first flagship initiative in health which we've seen in a number of years. And I hope that all of the initiatives we're planning for legislation will also feed into this, the pharmaceutical strategy, digital health, all of the other policy developments that we expect in the coming years will support the cancer plan. Thank you.
Thanks a lot. In the remaining time, I will leave much of the time to the audience for questions to you. Yet, I just would like to subline one point, is the fact, as I said, that there are the two of you in here on the stage. And it's something important because as much as I could hear from researchers, there's always some difficulty with the Europe, that the fact that sometimes part of the program address health, and they have someone, and part of the program address research, and then the story change, actually. And it might sound to be a bit confusing sometimes and limitative also for them, for promoting actions, for promoting model of cares, for promoting new integrated research. The fact that you are on scene is great. How is it going to be in live, on the ground, in the comprehensive center, you two, research and health working together? What's going to be different with this new dynamic of the plan and the mission together? How will you benefit one from the other?
Yeah, so that's why I was emphasizing that at the very beginning. I think it's really unusual. We have a policy process which has been agreed by the Commission, discussed with the Member States and with stakeholders. And what we're trying to do is to link the research agenda very closely with the policy agenda. So I think this is one of the big advantages of this process, that whatever is financed by the Cancer Mission will have a relationship with the broader policy objectives. And I think that's an advantage of making sure that the research program has a maximum value in the shortest possible time, because the mission is a short-term 5-year operation and is expected to have a short-term link between research and citizens. And I can't think personally of a more close link with citizens than their health. And therefore, I think mobilizing the cancer mission, mobilizing the research program, linking it to a public policy document and policy process will have great appeal for citizens, because they'll see that there will be change. Yep.
Joanna.
If I may just add something. Of course, this is a very real issue on the ground. As you said, it can be very confusing. What John just said is very soothing to that, in the sense that this was not conceived as something separate, which was then put together artificially. From conception, it was built up together, and that's very soothing. But, and the big but is, how is it going to be implemented on the ground? And I think this is what all of us, whether we are stakeholders, whether we are patients, whether we are interest groups, whether we are the national authorities, whether we are just citizens who wants to see the added value of this cancer mission and the Europe-beating cancer plan. What's in it for me? In the end, it's going to depend on how it's implemented. So there are already good examples being provided by member states, some member states. And I'm not suggesting in any way that it is the best practice or the best example, but they have found it to be already useful to have alongside the national contact points, the so-called national contact points, where they usually coordinate information and advisory services to citizens and to the interested stakeholders. But there are 3 or 4 member states, and I mentioned Belgium, Spain, Austria, I think also Romania, using European funds to actually conceive and actually implement a body of advisory services alongside the national contact point to actually serve the objectives, the common objectives of the cancer mission. Now, of course, this is encouraging. It's called, they're called BIRA centers. Even the Slovenian presidency mentioned it last December in their conclusions, that even the Commission should explore possibilities of having this sort of advisory center to actually advisory service to actually help the member states towards this. And we are thinking about ways of putting that into action, hopefully very soon as well. But what I mean to say is that in the end, at the end of the day, given that governance the instruments, and also the disbursement of funds is very much done at the national, regional, if not local level. At the end of the day, the cancer patient, the stakeholders want to see it happening close by and within reach. So I think it's going to be very much depending on each member state, what it works for them to actually make it happen on the ground. But the most important thing is to understand the concept and where we're coming from in terms of complementarity of actions, governance and funding instruments to actually make it happen in the end and deliver it for those who are asking for help.
We have just a few minutes left on the timing, and we can take one or two questions from the audience to John and Joanna. If you have, you can raise your hand, like it's the same rule that from the beginning of the day, and we'll take questions for Joanna and John. If not, I have some on the internet. One is excited to see this European Cancer Patient Digital Center. Do we know what it will look like, this digital center? Do we have some vision of what will be this digital patient center?
Yeah, I think there was some remarks earlier on about, do we need another app? But I think that's very much looking at it perhaps from the point of view of countries which have a developed system. I think the advantage of having a European approach is that you can take the types of patient information or patient data systems which exist in more developed health systems and to spread that more widely. So I think this is one of the objectives we want to reach, is to have a more uniform information system for patients, especially across Europe, using the different resources which we have. Perhaps a good example would be what the French authorities developed in the area of rare diseases, where they really made an effort to transfer information on rare diseases from one member state to another using a common database and a common approach.
It's going to be a data center also to get data from patients, this digital center, and for the data to be used for research or so, I'll guess?
Absolutely. I think at this moment in time, we do not really have a profile that is well defined, if you like, of the cancer data to member state level or to regional level. There are a lot of issues, of course, behind that in terms of personal data and all this, which need to be sorted out. But in the end, for research purposes, and in order to give the edge of what the European added value could be, if you join up these profiles together in order to get a better, more sort of a better focus picture, I think in the end it will help also to inform not only researchers about what they could research about, but at the end of the day, policymakers at European level to see what could be done at European level and what could be better addressed at national level.
If you want more of John and Joanna, you'll have to be with us tomorrow afternoon, because you'll be joining the two round tables, and we'll be focusing more likely on the different big disposals of the plan and of the mission, and see what might be put with this comprehensive center, with the survivor smart card we spoke about and so on. This is going to be tomorrow, because the clock told me that the day is ending for today, and I think we can really applaud John and Joanna for their vision. And their joint presence here today, and so it's a I don't know how to say it. It's a pitch for tomorrow. Come back tomorrow. It's a teasing for tomorrow. Come back for tomorrow. We'll have you back on the round table. Thanks a lot to you all. Merci beaucoup à vous tous de nous avoir suivis. Merci aussi à l'auditoire connecté de nous avoir suivis. On se retrouve demain matin pour la suite de ces journées, avec la restitution des ateliers et des statements dont John a donné quelques éléments tout à l'heure. Vous les verrez en détail demain. Merci à vous.